Welcome to Boombostic Health, where we challenge the business of healthcare and explore bold ideas that drive meaningful change. Each week, we bring you candid conversations with top experts, innovators, and leaders, exploring the latest trends and technologies shaping the future of healthcare. Join us and be part of the conversation in transforming healthcare.
Good afternoon. Marcus Gordon here, Boombostic Health Podcast with Dr. Luke Hansen of Arcadia. How are you?
I'm good. Thanks for having me.
Yeah, kind of a casual couch conversation, but nonetheless, we'll have some important things to discuss.
There's a lot swirling in the air.
A lot swirling in the air. So why don't you tell us, first right off the gate at HIMSS, this is the first HIMSS, I guess, in the true age of the AI evolution of the revolution.
Yeah.
Right. So tell me about it. What are you seeing, hearing? What's piquing your interest?
Yeah, you're totally right. Like since last year, this topic, this opportunity for the industry has like crystallized in a real great way.
Yeah.
The last year when we were here, it was a lot of talk, but it wasn't really clear what the use cases were going to be. And I would say actually there's been a lot of additional insights since then. Like the opportunities around agentic and automation are real and they're being deployed.
Yeah.
And I think everybody still knows there's a lot of opportunity. We're still like just scratching the surface on what this will mean for care.
Yeah. No, absolutely. And from your lens at the population health level,
Mm-hmm.
right? Because really it's about being able to scale, and be able to take these technologies to, where traditionally we haven't been able to do that before.
That's right.
You can take it in the acute care centers in the major metropolitan areas,
Mm-hmm.
but with your experience and being able to really take, a high level of care out into the more rural communities, which is amazing. How do you see the transformation and the enablement of all this technology really?
Yeah. So I think that access, the issue of access is fundamental to opportunities and avoidable cost in our industry. And the way that emerging AI technologies can, both augment the existing workforce
Mm-hmm.
and in some cases extend into new places where the existing workforce can't go. And they either can't go because of geographic factors that it's just too far to drive, or because to deploy a nurse into every household that could use a nurse is just too expensive. It's not a sustainable model for our industry. So I see the future absolutely including agentic presence, agentic relationships for maybe not the super sick folks, but for the folks that we know are going to rise in risk, they're going to rise in comorbidity burden.
Yeah.
And we need to be monitoring them and not missing opportunities to intervene, not just in terms of medical therapies, but in terms of the whole suite of things that contribute to someone's ability to self-manage chronic disease.
Yeah.
So it'll be interesting to see the timeline that plays out on. I think is to be determined a little bit. There's the technology that will need to evolve. And then there's probably also some social cultural acceptance of those relationships that I think it's really hard to predict. I think just in my life, I have peers who are diving into the use of AI technologies. And I think they would say making full use of what's available. And then others who are very skeptical and are, there's a distribution curve, just like everything.
Absolutely. Yeah.
I would say what's essential though, is that we make the technologies available and safe. And then those patients that are willing to integrate them into their care, they can opt in. So it's sort of a situation where, and providers for that matter, who are willing to adopt them as well.
Absolutely. Yeah.
So it's the trusting early adopters that will like teach us all the lessons of how to do this well and how to be effective with the new tools.
And, a big reason for some of the apprehension, from the provider lens and even from the consumer lens is data integrity.
Yeah.
Right. And we have all this data. How do we use it safely?
Yeah.
So what's your view on that? And how do we continue to transition, the safety and efficacy of the data in a way that over time can build credibility and trust?
Yeah. I mean, it's not wrong to start with an acceptance of the fact that these models, that machine learning is going to inherently spit out incorrect information sometimes. It is the nature of the tool.
Right.
And so to your point, how do we build safeguards around that so that the systems are resilient to that inevitable inaccuracy? But when you say that, it's really not any different than our human-driven system right now. We know, and the patient safety movement has really been built in the last 20 years on the recognition that, everybody not everybody, but essentially everybody is doing their best and still making mistakes. Mistakes are inevitable in human-based care, just like they're going to be inevitable in ML-informed care.
Right.
So we need systems that are it's really the patient safety paradigm. We need systems that are resilient to error, so that when an error happens, it's detected and corrected before it reaches a patient or it causes a bad outcome.
Yeah, and I think we kind of refer to it as the human in the loop element too, right?
Yeah.
Which is so critical to underscoring and providing the foundation for the trust and credibility moving forward.
And I think we have to be honest with ourselves about what the technology is ready to do and what it's not.
Yeah, absolutely.
Because there will be very tempting use cases, but if we're not there, we're not there. So that takes a level of discernment and honesty that, I think it'll be the buyers, it'll be the people purchasing this technology, that'll be on them to hold that responsibility as they make purchasing decisions.
Tell me about some of the great things you're working on at Arcadia.
Yeah. So, from just in the AI ML world, I kind of divide it into two camps. There's summarization tools and natural language processing based tools, and then there's true ML informed analytics. And on the former, we have an agent that will summarize chart information across diverse data sets, which is kind of our foundation, is to bring that data together in a database. But even together in a database, if you ask a nurse to have a new encounter with a patient, to search through all that information in a human-based query it's not feasible, and it certainly isn't as efficient as we need to be. So our technology will kind of roll up what's necessary to. I think it's particularly important in that first conversation, so that when a nurse is introducing themselves, or a care manager or some other healthcare worker is introducing themselves to a patient, that patient feels like, yes, this person actually knows my story. Right. And without that feeling that a patient has that this person is just another cog in the wheel of care encounters I'm having, that doesn't lead to behavior change. And without that, we're not going to manage chronic disease. So the summarization piece on the ML side, on the machine learning side, I mean, that's where I get super excited, because I think the ability to predict what both what a patient needs, and also what's going to work, which is a little bit different. Like, so there's I think we as me as a clinician, as a diagnostician, it's much easier for me to say this person has A, B, C, and so they should get D, than it is to know for sure if I tell them to do D, or I tell them to take medicine D, that it's actually going to happen. And our hope at Arcadia is that we can create a database that is robust enough to consider all of those factors. So it's not just the sort of the medical necessity or the medical next best action, but it's the context that this patient's in, and how likely is it that if a given specialist asks them to do a certain behavior or take a certain medicine, that they'll be able to afford it, that they'll be able to get to the pharmacy to get it, that if it gets into their house, that they'll know how to take it. Like, there are all of these external things that we don't model in our traditional risk modeling that are going to be really critical to getting to better. Yeah, no, I think that's fantastic. And, at HC1, we focus on the diagnostic piece. And I think, being able to have the foresight, as you said, into kind of, the patient's life, really more and not without actually getting involved in their life, right? Taking the data in a way and using that data to inform something that, the predictive analytic piece is, I think that's special, right? That's something that we're just really, getting our hands around here with all this technology. Yeah. It's going to be, and I'm, there's an appropriate balance, but I'm very optimistic that care will be transformed, and it will lead to better outcomes. It'll when I think of my practice, the idea that I could have prompted to me all of the things, all the diseases I've never seen, I've never taken care of, but they're out there. Right. We probably walk by those diseases all the time because we think it's just the usual thing. Like, there's this saying in clinical care that if you hear hoofbeats, think horses. Right. But there are these zebras out there. Yeah. And so if every patient is just treated like they're just another, horse in the analogy, there's a lot of care that we're missing an opportunity to deliver to do benefit. And, as a clinician, with all the technology being introduced and reintroduced, right, constantly into your workflows, your practice setting, how, is there a point where it becomes too much? Or do you think that the industry at large is managing it definitely and saying, okay, we understand that there are a lot of challenges and we're trying, as organizations to enable those to occur without,
having such an impact, right?
So I think what's critical, what is fatiguing is workflow change.
Yeah.
But these technologies can be infused into workflow where you're not even aware that the insights are coming from a much more robust analytic engine than what's happened in the past. It probably should be a part of every existing workflow to have a risk assessment piece of the work. But imagine that risk assessment piece in the future can be informed by some pre-visit surveys that we can deploy from information from other encounters the patients had that are bringing a more accurate, a more broad reality into the experience of taking care of the patient. But it's still, at the end of the day, I'm still going to interview the person. I'm still going to consider what that indicates, and I'm going to make a recommendation for treatment. But it doesn't have to be done with just the information that's in the four walls of the exam room, the way that it was, in the past.
So speaking of that, as we discussed earlier in our conversation, we're in the AI evolution of the revolution. Mm-hmm. What have you seen so far here that you're excited about? Kind of like what's on the horizon, or what other potential, whether it's a technology or.
Well, I guess I would say like there is this transition from last year that I alluded to, where like last year I felt like the AI optimism was so much around summarization and the ability of natural language processing to support. I don't know. I mean, as a provider, the way that it can help just lighten the documentation burden.
Yeah,
we're a quantum step ahead of that now, and the deployment of agents that's really in almost every AI product that I've seen here, like this fundamental belief that there's work that could be done more efficiently and more effectively potentially by an AI agent is the general characteristic. Now, like where that should live, I've only been here a day, but I think it's interesting that it still seems to skew at this conference much more towards the provider community and how agents can support provider work. There is this whole other patient community that I think will benefit from agentic support. And I think it's interesting to think about how we can get to that. I referred earlier to this future where the patients will have agentic relationships.
Yeah.
Like how do we find the cohort that's ready for that?
Right.
What are the sort of the demographic or disease conditions where that's most appropriate? To me, that's what's going to be the big unlock. So to your point, like there will be providers will leverage these technologies and largely do it through existing workflows that will become more efficient.
Yeah.
But for patients, we haven't really touched the disease management opportunities that can exist outside of the traditional healthcare setting. And that's what I'm excited to see in the future.
Yeah, it's great that you say that. I spoke with Amy Gleason a few weeks ago at Vive. And, I think because public policy, right, at the end of the day, it has to also be able to support that.
That's right.
We can't just have agentic AI agents talking, with someone on the phone, right, without, really good data integrity, interoperability, and public policy in place to support that. So, I mean, a lot of fast moving parts, but I think everyone is just, energized and jazzed up about really kind of committing to see how this can all just enable better care to happen.
I agree. I agree. It's going to be a fun period to look back on. That's for sure.
Absolutely. Well, Dr. Hansen, thank you very much for joining us today.
Thank you,
Enjoyed
Marcus.
it.
Take care.
Thanks.